story and get some reaction on that incident and also the state of that clinic. We speak to the DA's Gauteng spokesperson on health and legislature member Jack Bloom. Jack, a happy new year and a good evening to you. Thank you so much for joining us. Just the most concerning situation here that's played out in Westbury. I mean, just coming across what happened, your initial thoughts?
Well, it's devastating, and my condolences to the family. We should have had a new life brought into the world, and then for unexplained reasons, we have this absolute tragedy. So I think we need the answers as soon as possible. Obviously, there needs to be a more post-mortem, and they need to find out exactly what happened and what can be done to prevent this in future. Now, this was a brand new unit, actually. It's a maternity unit that was opened with great fanfare by the then Mayor of Johannesburg and the MEC for Health in May last year. So it was supposed to be a state-of-the-art maternity unit. It was a fairly small unit, but there were big promises made about it. It was set up to handle the overflow, as one could put it, from the Rahima Musa Hospital, because that's a very crowded hospital. So there were big promises made that this was a fully staffed and equipped unit. And here we have, not much later since it was opened, an unexplained death. In fact, 2 deaths, because there should have been a healthy baby as well. So let's get to the bottom of this. And why has this happened at this clinic? I've actually received quite a number of complaints about this clinic for some time now. It is actually a local government clinic, but the maternity part of it, as I understand, is run by the provincial government. So it is a partnership between the Provincial Health Department and Johannesburg Council. So we need answers, and this cannot be allowed to happen again. You can't bring back the dead, unfortunately. So, I mean, to the family, nothing will bring closure, unfortunately, for the loss that they've suffered. But they need to know why it happened and what will be done to make sure it never ever happens to anybody else.
Yeah, you talk, of course, about getting other complaints around this particular clinic. Are you able to perhaps give me a few examples of some of those, I suppose, complaints and what they have been about?
Well, there seems to be poor service at the clinic, which is a fairly new clinic. As I said, it's actually run by Johannesburg Council. And last weekend, in fact, I had a complaint about that somebody was severely injured there, and they called an ambulance, and the ambulance took a long time to come. And the primary care clinic is actually the first port of call. But if it's a serious situation with complications, they need swift transport, emergency transport to a neighbouring hospital. Now, the Rahima Musa Hospital is very near to it, and so is the Helen Joseph Hospital. So they would obviously need to have good transport in cases where the clinic is not able to handle a complicated case on its own. Look, maybe they're short-staffed over this particular holiday season, but that's no excuse either, because you should always get tip-top care. They need to make special provisions, and this was supposed to be the state-of-the-art maternity unit. So we need answers. Everybody needs answers. There needs to be accountability, and they must tell the truth. The family have already said that there were 2 injections administered. What went wrong there, and why did they initially seem to deny that these injections were given? I think we just need to have better management, full stop, both at primary healthcare level and at higher levels. And for maternity, when lives are at stake, because it's both the mother and the baby, one would think that the highest precautions are taken.
Yeah, the partner saying that she had complained that she was hungry, and he left to go and buy her food. He was back just within a few minutes, 20 minutes, I think, and when he came back, she had passed away. I mean, it certainly is one thing to say, okay, we need answers, and understandably the family wanting answers. But what's the likelihood, you think, that they'll see justice? I know that there is a police investigation, and perhaps also it gives us an opportunity to see what actually goes on inside a probe and investigation such as this one.
Well, that's why we need, a completely transparent investigation. The report must be released in full, and no cover-up. If people were negligent, or who knows, it certainly appears that there was gross negligence, then accountability. What are you going to do about it? Every year in the Gauteng legislature, I ask a question about what they call severe adverse events, and these severe adverse events have been going up all the time. In our hospitals, some of the larger hospitals, particularly, and what is being done about it? I'm just going from memory now, but there were sort of hundreds and thousands of severe adverse events recorded in a single year, but very little disciplinary action. In fact, as I recall, only 29 people were disciplined in the 1 year for thousands of severe adverse events. So obviously, if something like this happens and staff were to blame, and what happens afterwards, and why did it happen at this brand new maternity unit? As I said, it was opened in May last year. They should have had all the equipment, they should have had all the staff, and it doesn't seem to have been the case. So everything must come out.
Yeah.
I think everything must come out, and they mustn't delay, because it's very distressing to have delays. And whatever recommendations come out of the inquiry, they must be implemented.
Yeah, and we'll be watching as a lot of that information and those explanations do emerge, and keeping our viewers updated on it. Jack Bloom, we really do appreciate your time. Thank you so much for speaking to us. Jack Bloom is, of course, the DA Gauteng Health Shadow Minister, speaking to us this evening.